I have a lower back. I fell down the stairs a couple of years ago, and I've been in pain since then. The pain used to come and go, but now it's so consistent that it's affecting me to walk down the stairs, or even sit consistently in my car. It's a big problem.
We got a reading right there.
Yes, right there, exactly where you touched.
So overall, let me trace this down over here.
Yeah.
I don't want to see any swelling there. There should be no
But there is
fluid,
swelling.
but there is swelling.
Yes.
Exactly.
I even feel it with my own hands. Right there, exactly where you touched me.
Right here,
Yes.
swelling. And it starts to be fine up below it, but it's just right here, right in the exact spot. So when we test this fellow over here, how's that fellow?
It feels good because you're touching it. But yes, I feel the pain.
Here's the bottom line with your case over here, and you noticed it earlier. Normal, supposed to be nice and straight.
Yes.
It's not straight whatsoever. Why? Because this fellow over here got knocked out of alignment. No different from the leaning tower of Pisa. If the most lowest piece, if that's not stable, everything else is gonna follow suit. And that's exactly what happened over here. So when I see on this film over here, and just like what you mentioned on the MRI,
Yes.
there is some degeneration going on over here.
Yes.
What I want to see is this. I want to see this thickness. This is normal.
Yes.
What I see on the x-ray, you had this over here.
Yes.
It shrunk down in height a bit. That's what I'm seeing over here.
Yes.
In addition to this fellow over here, these two bones, they need to line up. What I'm seeing instead for you over here, normal, it's supposed to be this alignment. On you, it's backwards. So to give you an idea, what happens in normal alignment, see how much movement there is?
Yes.
This is what it's supposed to be doing. Knocked out of alignment due to trauma. See how unstable this is?
Yes, right.
It's quite unstable. That's why you feel that pain migrating not only just your right buttocks, but also help explain why you feel the pain shifting from the right side, left side, so on and so forth.
I have a hard time sleeping.
Bingo. So that's the fellow we're gonna fix. The strategy to correct this problem is as follows. Because we have some moderate degeneration at disc over there, and he has a sizable transverse process over here, and this is a sub-acute state, what we're going to do is we're going to do a lamina transverse contact and correct that fellow over there.
I went to some specialist and they said they would have to do surgery and shave off the extra nerve that's being hit. So what do I do in this case?
All right. So it's not a nerve what they're shaving off.
Oh, okay.
You may have misheard. So what they actually do is this. Now,
The disc.
no. Right. So unfortunately, you didn't bring the MRI in.
No.
So I wouldn't be surprised when you, on the next visit, when we take a look at your MRI, you probably have a bulge, a disc herniation just like this.
Yes, I do.
So what they're suggesting is what's more commonly here in New York City, they will do a microdiscectomy. To clarify, this part over here bulged out.
Yeah.
The surgeons, what they'll do is they'll cut this part out,
Yes.
stitch it up, and also possibly suck out some of that liquid ball bearing out to get this swelling down and to take the pressure off that nerve.
Yes.
So that's the reason why we're doing the lamina transverse contact. That's a much more deeper correction, and it's meant for subacute conditions. So when we reposition this structure back to where it gotta be, in essence what we're doing is this. As we see over here, it's this nucleus pulposus over here. Now, I don't know exactly which position it went on your case because we don't have the MRI. It may be here or maybe here.
No, it's here.
I would not be more surprised because of the way we examine and test the structure. I would not be surprised you had the breach over here. All right? So, in essence, what we did for you is this. Realign that fella back to where it gotta be. In essence, push majority of this liquid ball bearing back into center position. And because, just like we see on this side, you have multiple breaches. There's 25 layers of these fellows over here. Now, I'm not saying full breach, because if that was the case, you'd be limping, right? That's not the case. I would not be surprised when we take the MRI, take a closer look. You may have ruptured half the amount, or maybe 2/3. Hard to say. I gotta take a look at the films, right? So when we reposition the nucleus pulposus back into its place, your body will now start forming a clot in every single one of these layers. That takes 2 to 4 weeks to happen. So in the meantime, don't do anything to try to re-injure this disc again. As long as you follow our recommendations over here, it's going to clog all these holes up, heal up very well, you'll be good to go. And you don't even need to do the surgery.
Oh, thank God. I don't want to go to the needle.
All right, go ahead, see what you can do. So at what point does it start happening?
No, I'm already down here. I'm very
Uh-huh.
flexible, but I feel the stretch right here in this area. But because I'm flexible, it doesn't affect me directly, but the
Mhm.
pain is there.
Roll you over, don't worry, you're not gonna fall. Come on up. Walk around.
Much better.
What's much better?
The pain is not there.
Why don't you go ahead, flex forward, just see what you can do.
Nothing here. I feel a little bit strain on the other side.
So you don't feel anything on that right buttocks anymore, huh?
No.
But a tiny little strain on the left.
Yeah,
How do you like that, huh?
that's much better.
Okay, so to help explain why you feel that little strain on the left side, because your body, it's accustomed to do the zigzag over here.
Yes.
We corrected your structure, now your body says, hey, whoa, I'm in proper alignment. Because it was trying to fight for quite some time to try to realign the structure as best as can. However, it couldn't. That's why we need a little helping hand. Right? So now that we corrected the structure, now your body is now readjusting itself, readapting to where the new position is. Therefore, boom, left side, it's a little sore. It's to be expected.